Hello, dear colleagues. Today I want to make a preview of the upcoming course on OHI-S platform dedicated to the use of the passive self-ligating system called Damon 2.0. You might heard or you might have seen very popular and very nice course about the use of passive self-ligating called Damon 1.0. And among others, on those series of lectures were presentations by Stuart Frost, Alan Bogdan and Chris Chung, those giants of orthodontics who started to use passive self-ligating systems since the popularization of this method of treatment by Damon. So what's so interesting will be an upcoming course about Damon System 2.0. Well, the list of experts: Bill Dischinger, Nasib Balut, Trevor Nichols, Amr Askar, Alfredo Rizzo and Dmitry E. So what kind of information you can get from those experts, from those speakers, if you sign up for this course? Well, Bill Dischinger, the doctor from San Francisco, he will tell you about the treatment of different malocclusions, but first of all, he will discuss with you the principle of diagnostics and decision-making process, how to analyze aesthetics, objective and subjective information about aesthetics, the fundamental principles of the passive self-ligation that is very important to know before you start working with it. Cephalometric analysis and orthodontic treatment. I still think that it's very important to know and to use this method of diagnostics for the treatment planning. Also treatment of adolescents, of adult patients, and treatment of children in mixed dentition. And he will present you some complex cases where he utilized Damon system, passive self-ligating system, for achieving good result. And he will also discuss with you the topic of retention. Then, very famous doctor from Italy, Alfredo Rizzo. He will discuss also very popular malocclusions that you treat every day in your daily practice, in your routine. It's class 2 malocclusion and crossbite. So he will discuss the correction possibilities of these kind of malocclusions, expansion and remodeling concept, also the use of degainer that is very useful in mixed dentition for achieving very nice expansion. The sequence of treatment in crossbite treatment and the sequence of treatment in the class 2 treatment, and of course he will show you a lot of clinical cases. Dr. Trevor Nichols, I don't think that I have to present this doctor to you. You already know him from the Damon 1.0, where he presented a lecture that is available right now about the treatment of adults using passive self-ligating system, where he showed 5 keys to create a beautiful smile, how to use laser for soft tissue contouring, how to utilize principles of the teeth recontouring, when to do that, how to do that, what tools to use for that, also how to use skeletal anchorage, different types of skeletal anchorage, and how to achieve predictable results. And also the camouflage treatment for the class 3 malocclusion. That is also a very important topic when you treat adults. In his next lecture that will be presented in this new series of webinars, he will talk about the different types of class 3 malocclusion more thoroughly. So he will discuss 3 techniques for treatment of the class 3 malocclusion, how to achieve this perfect result in camouflage treatment, and how to achieve confidence in treatment of these patients, and how to use bone anchors for achieving predictability and efficiency of treatment. And Dr. Amr Askar, very interesting topic, and I'm personally looking forward to listen to his lecture because it's still very, very contradictive. Treatment of impacted teeth. So, diagnostic of impactions, how to approach to the treatment plan of the situation with our impacted teeth, what kind of flaps we can choose in different cases, and how make these flaps appropriate for the treatment. Well, different cases, different situations when there is a retention of the incisors, retention of the molars, and of course retention of the canines, and different types of retention, including the horizontal position of the canine and how to treat it. Also, he will discuss very important right now and very modern technique of creating the approach and access to the impacted tooth using Vista technique. Then, Dr. Nasib Balut from Mexico. So his lecture, he actually would have 2 lectures. First one is dedicated to the key factors in treatment of the class 3 malocclusion. Well, you know what's interesting? In this series of lectures, a lot of doctors will discuss class 3 malocclusion. Usually, not so many orthodontists like to talk about this topic. We hear a lot about the class 2, we hear a lot about crossbite, but class 3 malocclusion is somehow, it doesn't maybe have so much attention as it has to be, because right now we see more and more patients, adult patients who seek treatment, who want to be treated, and not all the time they could be treated with the orthognathic surgery. So Dr. Balut will discuss the OHI-S sequence in treatment of class 3 patients using passive self-ligating system. Also, how to achieve good and predictable result, how to make proper diagnosis, in which cases you can try camouflage treatment, in which cases you'd better send patient, refer him to the orthognathic surgery. That is also very important to know when, how, and what. And his next lecture would be dedicated to the very controversial topic. And there are a lot of legends surrounding Damon system, especially. One of the legends is that in this system you don't need to extract teeth. Well, you still need it, but the thing is, you don't need to extract teeth for crowding, for relieving the crowding, for getting space, because with passive self-ligating you can have any space you want, well, in case of moderate crowding, even severe crowding. But usually we decide that we need to do extractions for the face, and that's what Dr. Balut will discuss with you. So how to make decision about the teeth extraction, what are the OHI-S sequence in case of the treatment with teeth extractions, and different cases, of course, to show you how to achieve very nice and predictable result. And my personal friend, a doctor I know very good, Dmitry E., he will discuss also very interesting topic of treatment of class 2 malocclusion, and here we'll discuss with you the topic of elastics. Also very, very interesting, because he will discuss early elastics. Also a lot of contradictions around this topic. How to choose which kind of elastics to use, what direction, what to expect from their utilization during the treatment, what kind of side effects it could be, how to avoid them, torque selection, space closure, and effective communication with the surgeon if you need to do the combined treatment for orthognathic surgery. Also, during the course, doctors will describe the use of the Herbst appliance, the use of auxiliaries in Damon system. So, who I can recommend this course? To every orthodontist. It doesn't matter what kind of equipment you use, what appliances you use for treatment of your patients. Biology is the same. Mechanical principles are the same. So it's very nice to see the experience of very, very also sophisticated doctors who have many years of achieving great results. So if you're a Damon user, it's definitely the course for you. If you use some other passive self-ligating systems, of course, this will be a very useful course for you. But if you somehow think that passive self-ligating is not for you, I think you will find a lot of interesting tips and tricks how to achieve good aesthetic, predictable results, and how to make a decision about the treatment planning of different malocclusions that happens in your practice. So, my dear friends, my dear colleagues, I recommend to you to get acquainted with this sequel to already very successful topic, use of Damon system in treatment of patients with different malocclusions. And I hope that it will be time worth spending. So have great results and grateful patients. Good luck.